And various levels of lockdown have taken a toll on many people's health. A new study from the American Psychological Association out this week found 82% of adults never imagined the pandemic would last this long. So how does our mental health look a year into the pandemic when it comes to general stress, addiction, and the added stress that comes with parenting and kids at this time? Let's bring in American Psychological Association President Dr. Arthur Evans, Harvard Professor of Psychiatry and Addiction Medicine Dr. John Kelly, and psychiatrist and parenting expert Dr. Janet Taylor. Thank you to the three of you for being here this morning. Dr. Evans, I'd like to start with this study on stress in America from the APA. Who is struggling the most and why?
Well, what the survey found is that many Americans are struggling, but the groups that are having the most difficulty, as we might imagine, essential workers, parents of small children, particularly children who are being schooled at home through remote learning, people of color, and Gen Z. That is that young group of young adults up to about the age of 23.
And Dr. Kelly, the pandemic has been incredibly difficult for people struggling with addiction as well. We've seen a roughly 40% increase in opioid deaths, overdose deaths from 2020 compared to 2019. So what sort of an impact has the past year had on those struggling with addiction and those in recovery?
Well, it's had a mixed impact. One of the, obviously the stress and social distancing and social isolation incurred under COVID has been a major stressor for people in recovery, but people also, importantly, starting recovery who just struggle to get a foothold, as you can imagine, via social distancing, just getting clinic appointments in person, getting on to meeting other people in recovery has been very challenging for people getting a foothold in recovery. People who are already in recovery, I think a lot of them have transitioned to online resources pretty successfully. But it's certainly been a challenge in terms of the stress and social distancing overall.
And Dr. Taylor, according to that APA study, 75% of parents say they could have used more emotional support this year. What do you make of that number and the impact that this year has had on parents in general?
Well, it's accurate because, as a parent, you're in charge of your child, but you're also worried about whether you're going to pay the rent, the mortgage, your job, you're isolated from your parents and those familiar sources of support. So that certainly translates into women. Moms report some of the highest levels of stress during the pandemic, post-pandemic, and then that unfortunately will translate to children because stressed parents and especially stressed moms unfortunately can make kids feel stressed, out of sorts, uncertain, and children are worried about the health of their parents and grandparents and caregivers, and also away from their usual sources of support, which could be, their classmates and their teachers. So it's really been a challenging time for parents and families' mental health.
And Dr. Taylor, it's not just the parents, the kids have had a hard time too. What concerns do you have about children's mental health right now?
Well, the main concern I have is even pre-pandemic, and I'm not a child psychiatrist, but adult psychiatrist, but see kids in the clinic I work in. And pre-pandemic, there were kids who were anxious, lots of isolation. I think a real emphasis on, certainly technology and playing these games where they're not connecting with other children as much. And during the pandemic, certainly that has been heightened. So my concern is, how children will deal with their anxiety in a healthy way, certainly a lack of sleep, and just the uncertainty and angst that brings to kids who worry anyway, and just what we need to do to ground them and certainly teach our kids how to be more resilient and cope with what is a temporary event, but hope in a way that it will not impact them long-standing in terms of just excessive worries or fears.
And Dr. Evans, in this stress study, you also found that Americans are nervous about returning to fully in-person work and social events. Do you expect that will ease once vaccinations are more widespread and the CDC says those activities are safe, or is this something we're all going to have to get used to even after that point?
Well, I think this is something that we're going to have to get used to even after the vaccines are widely distributed. Right now, there's really no difference in the way people who've received the vaccine versus people who haven't received the vaccine feel about the future, the anxiety about the future. And one of the things we know about people who have prolonged stress, and that's essentially all of us because we've been at this for over a year now, is that it has long-term consequences. That's the real story here, is that when so many people in our population have experienced long-term chronic stress for this amount of time, it's really important to understand that we're going to see the effects of this not only in the months preceding, in the immediate aftermath of the pandemic, but long-term, perhaps going out several years, which is what we've seen in other kinds of crises like this.
So, Dr. Kelly, what can we all do to cope with this, especially those struggling with addiction right now?
Well, I think there's a number of things that we can do, which people have done, which people are doing. You can kind of summarize this, what I call a SANE approach. SANE stands for social, A for activity, N for nutrition, E for emotion regulation. And, it's very important for people who are initiating a recovery attempt and also who are in recovery from a substance use disorder to maintain connection. So that social connection is so key in recovery, just for the accountability, for the support that people need, the recovery-specific support. So that's the social aspects are very important. Activity, just making sure that we get up and get out the door, hopefully, where we can actually get some sunlight, get some exercise, get the blood circulating is going to be very important for general resilience, but particularly for relapse prevention. Nutrition is another one. Making sure that we don't succumb to the temptation of comfort food. Some of that's okay, but too much of that can deprive us of kind of natural important vitamins and minerals, which can subtly affect our cognition and mood. And then the E of the SANE approach is emotion regulation, really trying to look for a silver lining wherever possible. Can we focus on the positive? Can we be grateful for something every day? Can we look to our peers and other people in our social network who can help us see some of the positives? And so those are some of the things that people have done to build resiliency and prevent relapse.
All right, Doctors Arthur Evans, John Kelly, and Janet Taylor, thank you for your time this morning. We appreciate it.
Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.